I'm gonna have you cut this because
Yeah.
I'm trying to think of what I said.
You're
Halloween, brightening, and there's one other thing that it does.
Hi guys, I'm obviously here at Modiki Med Spa, and today we are going to do PRFM to my under eyes. We've had a lot of interest on this, or in this, ever since we published our Lily Ghalichi video, so that's why we're doing this today. You guys can see the transformation. This is obviously before. If my skin looks a little orange, it's because I recently had a spray tan and it's starting to fade. But this is my before. I don't have a lot of hollowness under my eyes, but this should brighten it. But shortly hereafter, I'm gonna bring Sarah in and she can explain a little more. Oops, God. I hate how it cuts tighter when it's closer. All right, so we are here with Sarah.
Oh, we're recording.
Yeah,
sorry.
we're recording.
Okay, so
we're
sorry.
on. So we're here with Sarah. She's one of our injectors here at Modiki Med Spa. She's going to be treating my under eyes today with PRF.
We sure are.
I took my glasses off and I showed kind of like an up close on the camera.
Perfect.
And I don't think, in my opinion, they're not like super hollow, but can you just explain what PRF might do to me and kind of the overall benefits?
Sure. So PRF, it's good because it's beneficial for a variety of different reasons and for a variety of different patients. Ethan, he doesn't have really bad hollows. He's had under eye filler before, but what PRFM is really, really great in doing is building collagen, stimulating collagen production underneath the eyes and actually thickening the skin a little bit. On just about any person, your under eye skin is one of the thinner parts of skin on the face and on the body, and so typically when people have darker under eyes, it's because you can actually see the vessels underneath the skin. That's usually the reason. So by thickening the skin, it can actually brighten the under eyes. It can help improve the hollowing a little bit. It helps a little bit with the pigmentation if it's because the skin is thin. So with Ethan, he's still on the younger side, but you can see that he's starting to get just a little bit of crepiness under the eyes, and he still has like a little bit of the crow's feet even from doing Botox, because we can only really get so much of these wrinkles around the eyes. Some of them are from your orbicularis oculi muscle contracting, some of them are from your cheeks pushing up when you smile, which we'll never get rid of. So it's just going to kind of help to brighten and refresh the under eye area, and then it's also preventative with aging, because the under eye area is one of the first places that we start to see aging, especially with our masks. All of the attention is on the under eye area, so it's really nice to have a refreshing area. A refresh.
To refresh, yeah, to have a
refresh the area.
Yeah, to have a refresh. Okay, so I think, so what led to us making this video is Dr. Modiki's video on Lily Ghalichi's occlusion. And that sparked a lot of interest in PRFM.
Yeah.
Definitely sparked my interest, which is why we're doing it today. But to clarify, can you still get an occlusion from PRFM?
So when you look at like definition of occlusion, it's foreign body entering a vessel, which is a risk with any type of procedure that we're going to be sticking any type of needle or blunt needle and injecting anything. Yes, it can get in the vessel, but just to keep in mind that it is more natural than filler. So, you know, it's derived from the blood, it's derived from the vessels. So I personally would say that it is a safer procedure.
And then just to reiterate kind of what Dr. Modiki already said in his Lily video, which I know just from working here, we already employ here at Modiki Med Spa, which is you'll use a blunt cannula today. We
use a blunt cannula, which for those of you who don't know, a blunt cannula basically looks like a long needle, but the end is like this. The science behind it is that it's supposed to push vessels out of the way instead of go into the vessels. We always insert our blunt cannulas very slowly. We're not trying to push through things. We're always aspirating. We're pulling back, making sure we're not in a vessel before we inject.
And aspirating is like the true sign of a potential occlusion, right?
That's what we hope.
Yeah.
We take, you know, there's always a small percentage of a chance that you're still in a vessel, something doesn't come up, but we take every precaution that we can, and we have a protocol for all of our injections that basically goes step by step on how to solve it so that we can reverse it as quickly as possible and reduce any damage. Right, perfect. And then go ahead and rest your head back. Right now I'm just numbing the areas that we're gonna enter, which I probably wouldn't have to do, but we're just doing everything to be comfortable.
Just to be comfortable.
This can sting just a little bit, okay?
So here you can see Sarah injecting me with numbing solution, lidocaine. This just makes the injections feel a little bit more comfortable. Overall, it didn't hurt at all, but the lidocaine definitely helped.
It's the PRF mixed with calcium carbonate, which is what makes it a little bit thicker. 1, 2, 3, ouch. You probably didn't feel that, huh?
Nope. So this is the PRF, and I'm doing someone else's job. I just thought I'd clarify that there's usually a nurse's assistant in the room, but she was busy and I'm an employee.
You can see how we're going nice and slow in here.
A little bit of pressure on the eyes. That's okay?
Mm-hmm.
So are you doing it?
Mm-hmm. How's it feel?
Like pressure,
Mm-hmm.
but not bad. I always get in my head when I do anything under eyes. It always freaks me out a little bit.
That's okay. It's very normal.
It's also weird because you're so numb. You can't feel like anything besides pressure.
Which is good.
Is that it?
That's it for that side.
Wow.
Sure
Not
thing.
bad. Unintentional side eye. So Sarah just treated this side, and I don't know, do you see the results right away? I mean, do you?
You see like the swelling for sure
Okay.
right away, but
I was gonna say, because I feel like I look like a little bit swollen right here.
oh, for sure.
Okay.
We almost want it to like look a little bit overdone with PRF, which is something that we wouldn't want with under eye filler, obviously, but.
And then she'll treat this side so you guys can kind of see right now the difference between the two. But yeah, I don't know what I'm saying. So of course what you're seeing right now is just Sarah treating the other side of my face. It feels the exact same. Not a lot to say in terms of differentiation between sides. The entire process, beginning to end, took about 45 minutes, so it's definitely not a long treatment. The biggest time consumer is drawing the blood and having it spin to separate the PRF. But once she got to injecting, I would say it maybe took 20 minutes max.
Another good thing about PRFM treatments versus under eye filler is that we can get really, really close inside the orbital rim, which you can't really do with under eye filler because this is a very superficial treatment, whereas under eye filler has to go periosteal, which means on top of the bone, so you're kind of limited on the orbital rim.
My eyes look a little bit heavy in this footage, and that's just because watching the needle go in and out kind of freaks me out, so I wanted to close my eyes. Sorry, I'm not talking, I'm just like observing. I'm gonna need an upper blepharoplasty at some point.
You are a crack up.
For those that are watching this, if you have questions either for me as a patient or for Sarah as an injector, please leave them in the comments below or hit us up on Instagram at Modiki Med Spa and Aesthetic Nurse Sarah.
So you can see once I get up here, I'm still gonna aspirate and pull back. We don't see any blood return, so we're good to go ahead and inject.
And that was it. All right, so we just finished my treatment. It was super easy as a patient. If you're used to getting under eye filler or any type of injectables, this will be a walk in the park for you. My husband is 63 and he's like super afraid of needles and all of that, and I would definitely be comfortable recommending this treatment to him. As you may see on the video footage, she does numb you prior to treatment, so it just feels like pressure under the eyes. It's not like a super intense or heavy feeling. It definitely doesn't feel like lip filler where you have like a million little pokes. This is one poke and then the cannula just goes in. Again, I can't reiterate safety, the importance of safety enough. So I don't know how you guys are with your under eyes, but I'm super afraid of pretty much any complications in the under eye area. So going somewhere that employs every kind of safety protocol is very important to me. And I knew A, from working here, but B, from just talking with Sarah and the med spa manager, Sheena, and all of the other providers here, that of course we have an occlusion protocol, and also we employ kind of like the safest protocols within the industry. So if you're not in LA or if you don't go to Modiki Med Spa, definitely look for that with your own injector. I'll be sure to post my before and after when my results are here. But overall, super easy, would recommend 10 out of 10, not at all uncomfortable.